At Jack Nathan Health, we believe that we're going to revolutionize healthcare. Revolutionizing healthcare is about providing access to patients where patients traditionally had no access. Wouldn't it be great if we create a standard in healthcare, a standard symbol that you know when you walk in anywhere in the world, you would get consistent quality healthcare, the equivalent of a Canadian healthcare experience, something that we pride ourselves. Canadian healthcare is probably one of the most exportable services that we have in Canada. We will be able not just to export the technology, but actually export the healthcare professionals to train other physicians, collaborate with other international physicians on what a retail healthcare environment looks like. Retail health has been part of our DNA in North America for a long time. It's time to show the world what Jack Nathan Health can do.
We wanted to play a role in improving the Canadian healthcare system. So we wanted to figure out how we could improve access. We've embraced best practices and worked with best-of-breed vendors to provide a state-of-the-art clinic for our patients and for our physicians. We've been very fortunate. In Canada, we've partnered with some of the most well-renowned physicians across Canada, many chief of staff, chief of emerge at local hospitals across Canada. We currently have one of Canada's largest healthcare networks with over 400 physicians practicing in 73 medical and dental facilities in 6 provinces across Canada. We're currently seeing 2 million patients annually. The success of our clinic base has allowed us to expand into hub facilities that are going to support clusters of our clinics in a hub and spoke relationship across Canada. This will allow us to provide more comprehensive care and a broader suite of services all under one roof, which include family practice, walk-in, diagnostics, lab, dental, all services available on demand. We've built barrier-free facilities, which means you could have a wheelchair rotate anywhere within the clinic. On outage, we're able to fail over our primary circuit to a secondary circuit to maintain business continuity for our physicians.
We are the right company to expand, provide access, and provide what every consumer and patient needs these days, and that's a one-stop shop environment.
Site selection was a very important element of our venture, and we determined that 1 million people were walking through Walmart supercenters every day. Wouldn't it be a great idea if we could actually bring the clinic to the patient instead of having the patient go to the clinic?
Mike Marcelletta, president of the management company that has set up clinics at Walmarts across the country, says it's all about convenience, even when you're waiting to see a doctor.
You can take a paddle pager and you could browse the electronics aisle, grab your groceries, and we'll buzz you when it's 5 minutes to your turn.
We help Canadians turn downtime into uptime. One young lady in Saskatchewan was very happy and she wrote me a letter. So she was able to see the eye doctor, then over to see the medical doctor, over to the pharmacy, and during a little bit of wait time, she was able to pick up some groceries, all under 30 minutes. And that example is the essence of what we bring to the customer and to the physician, added convenience, all bundled under one roof.
Today I'm going to take you through a tour of one of our locations here in Scarborough, Ontario. We serve every single nationality right across the country. We're a very multidisciplinary clinic with a great following of many different people. Today here we're offering cardiology services where we have a full suite of cardiology testing, diagnostic testing, long-term testing, and counseling. Alongside our cardiology services, we also offer a full suite of physiotherapy, massage therapy, and chiro services. Here I'm showing you our dental clinic, which is conveniently located right beside our medical center here in Scarborough. In this office here are conveniently located to have 3 full-time physicians working. We offer EMR, so everything is electronic, less paper. Ancillary services are a way to complement the practice and enable our patients to have a full suite of services under one roof.
Wouldn't it be great if your entire health record could travel with you? It was literally at your fingertips as an app on your smartphone. What has been prescribed to you? What you may be allergic to. translated into the language of the country that you are traveling in. The information that you could provide access to a foreign physician, where they could not just disseminate that information, but understand how to expand the conversation, how to customize your healthcare experience. We believe that having a shared medical record environment is not just important, it's essential. Without understanding the patient that is being treated, how can you possibly administer a medication or a medical procedure not understanding what may be affecting the patient?
Studies have shown early adopters around the globe have lowered the occurrence of adverse drug events by millions annually by adopting a digital EMR strategy. This has been a very important element for us. Other countries have shown a reduction of simple things like labeling script errors on prescriptions from 20% down to 2%. In the early stages, we wanted to begin with the end in mind, which is accommodating the patient of the future. Currently, there's 5 million Canadians over the age of 65. Over the next 2 decades, 1 in 4 people will be over the age of 65 in Canada. It's going to drive an incredible strain on the Canadian healthcare system. We've been building our clinics with that in mind.
They are not national problems, they're global problems. And now that we have locations in Mexico and opening locations in China, we're looking at 7 other countries. The most important thing we can do at Jack Nathan is stay on course for international expansion. The world is getting smaller. The world is more connected than ever before. There is no reason why we shouldn't have a connected healthcare experience. The most important thing in everybody's life is family. I would like nothing more than at some point to leave this world knowing that my children will have access to consistent quality health care. We have to be prepared to help those that want to help their loved ones. That's what we do.